Yes, sir.
Yes, sir. Sir, you have muted, sir. You're on mute.
Yes, we discussed that anxiety, no? Hello.
Yes, sir.
What are the various the anxiety disorders? Specific anxiety?
General anxiety.
Then
So
generalized
general
anxiety?
anxiety.
PTSD? OCD?
Substance-induced anxiety disorder,
Okay.
post-traumatic stress disorder,
Mm-hmm. OCD?
OCD, acute stress disorder,
Okay, these are some issues related to the
anxiety.
anxiety. Now, depression? What is depression?
Loss of hope, sir.
Loss of hope? See, these are all anxiety or maybe depression. We elaborated define these anxiety or depression based on the symptoms. What are the symptoms of anxiety?
Overthinking.
Loudly, please.
Overthinking.
Audible?
Yeah. Sir, overthinking about the future.
Your voice is very low. Anyone?
Sir, unable to concentrate and worried about future, worrying excessively.
Okay.
Sir, one more thing, not able to enjoy the things that previously enjoyed the person. Less concentrate and no appetite and sleep disturbance.
Yes.
And not feeling to do the things actively.
No feelings.
Yeah.
And a pessimistic behavior about pessimistic attitude towards the
So
future.
these are all the various symptoms of depression.
So
Generally,
yes, and some physical symptoms also, sweating in the hands.
sweating,
Yeah.
dryness of the mouth,
Heartbeat. These are the things.
Palpitation and overthinking, spending time alone,
yes.
deeply thinking about one particular thing.
Less levels of confidence,
Poor social interactions,
low confidence levels,
Low motivation,
lowness,
loneliness.
yes.
So,
and loss of memory also, sir. No, not having.
So these are all some symptoms of
socially isolated also.
that's what social isolation means, poor social interactions.
Yeah.
Okay. Yeah. Then What are the other symptoms of depression?
So they like to stay alone, like they like to stay alone in dark place.
Mhm.
Don't want to interact with others.
Avoid to
Pretend.
attend the social functions also, gatherings and functions.
Mhm.
Mm.
Then how to assess this depression? Assessment of depression. Assessment of depression. Anyone?
So first we need to know.
Yeah, Ushasri.
We need to think with whom we
Anxiety
are.
and depression also. There are some tools of assessing anxiety as well as the depression.
And based on the age criteria, also we need to talk to them and build a connection. How to deal with them.
Anxiety inventory scale is there, so we can assessment the
Mhm.
and stress. Also, they have inventory scale and
See,
counseling
in
can.
anxiety cases, one that is D, Hamilton test of depression. Hamilton, Hamilton, Hamilton scale of depression. That is Ham D. Ham D. Ham is Hamilton. Hamilton scale for assessing the depression. Ham A. Hamilton tool or Hamilton scale of assessing the anxiety. So the assessment of anxiety depression is Hamilton D. Even for depression, we will use that interview also. So interview or other structured and unstructured tools are available for this assessment of the depression. Then see here, if there are different age groups of depression. Okay. Hello.
Yes, sir.
Yes, sir.
Yes. Yes. So here, how the interview? What are the main items you will ask in the interview? Okay. So here in the interview cases, one is first of all we need to build up the rapport with the patient to screen the symptoms. Okay, collecting the information with the help of the caregivers as well as patient, or you can say subject. Okay, so here whether any suicidal tendencies are there or not. Okay, hello. Syed Ayesha, your voice is very low. You are not able to understand what is your question. So for this depression cases, one is CBT, cognitive behavior therapy. For depression cases, cognitive behavioral therapy is the one therapy generally we use in our counseling sessions. That is one important. Second is cognitive restructuring. In cognitive behavioral therapy, cognitive restructuring their cognitive process. That means thought process. For example, generally what happens based on some two or three cases, based on some two, three examples, they will generalize the things. Specific examples of dysfunctional thinking style that are relevant to depression include overgeneralization. Overgeneralization means, for example, I am worthless because I did a poor job at work. So I am not in a position to work properly. That means I am worthless. Generalizing, you can say overgeneralizing. In that particular cases of overgeneralizing, if the thought process is not up to the mark, so better to go for the CBT. In CBT, cognitive restructuring technique, cognitive restructuring process or cognitive restructuring technique. That is one technique, one therapy we use in these cases. Okay. Second is interpersonal psychotherapy. Interpersonal psychotherapy. As I mentioned, in some cases of depression, if they are not sharing their emotions to others, okay, isolation, so better to involve them interacting to other members in the group or the family. So improving the interpersonal skills. Interpersonal psychotherapy is, it is an efficient intervention of depression, but here in this case of intervention, what we do generally, we improve the social skills. Okay, to interact their emotion, to express their emotion, to share their emotions to other members in the group. That is one important technique we use in these cases of depression. Then behavioral therapy or behavior modification therapy. What is behavior modification therapy? If there is any child-related cases, if there is any early adolescent cases or later childhood cases, so better to modify their behavior. You can say behavior therapy or behavior modification therapy. Reinforcement, shaping, role play to enhance their social and communication skills. For example, if you find any problem with their communication, due to lack of the communication, they are not in a position, they may not be in a position to share their emotions, to express their emotions to others. Here, we need to improve the social skills. That means if they start communicating their emotions to others, so we need to reinforce here because they are improving their social skills. Our target is in this behavior therapy, our target may be improving their social skills, enhance their social skills. So in this behavioral therapy intervention, we will modify their behavior means their behavior is a problematic behavior. Problematic behavior means they are not interacting with other members in the group or in the family. What happens if you or somebody is not sharing their emotions? What happens? They themselves think in their own. Okay, so overgeneralization, as I mentioned. In this case, one technique is in psychotherapy. One important thing is behavior modification technique. Then in CBT, behavior modification therapy, and improving the social skills. Then cognitive reflective technique. These are all the various techniques we use in our interventional process, interventional program in addressing the issues of depression. And pharmacotherapy means by using some medicines. Medicines means from the medical professionals, not from us. So we give the counseling only, some therapeutical procedures. So psychotherapy, behavioral therapy, communication technique improvement, interpersonal psychotherapy, these are all various techniques we use in these cases of depression.
Sir, only psychiatrists can give pharmacotherapy, sir.
What is?
Psychiatrists only can give pharmacotherapy.
See, psychiatrist is the medical professionals.
Yes.
Psychiatry.
Yes.
After completion of their medicine, MBBS degree, that is advanced course.
Yes.
DNB course in psychiatry.
Okay.
Okay.
Okay, sir.
They can prescribe the medicines.
Okay.
Psychiatric professionals, because they are the professionals from the medical background.
Yes.
But as psychologists, our role is provide psychological counseling. not prescribing, not advising any medicines. So this therapy, that means pharmacotherapy, is only from the medical professionals, not from our psychological professionals. Got it?
Yes, sir.
Yeah. So depression is across the lifespan. Depression may be the small children, means like child cases, depression in adolescent cases, depression in adulthood cases, depression in older adults, like old people. So in the case of children, very minimal percentage. In depression in children is very few cases, only very minimal cases, like 1% to 4% of. You can find the cases of depression in this childhood at this stage, only 1% to 4%. Okay. Then whereas in the adolescent cases, so maybe in the adolescent case again, one is early adulthood stage. Okay, about 5% of early adolescent cases, whereas the age between the 12 to 19 and are 14 to 18, nearly 20% of the cases. The depression cases in the childhood is very minimal, like 4% or 5%. In the later childhood or pre-adolescent stage cases, only 5% around. Whereas in the above 12 years or 40 years, adolescent stage case up to the age of 19 or 18, so nearly 20% of adolescents experience in the depression between 12 to 19 years. Okay. What are the reasons behind it? Why these adolescents having depression issues? One important reason is sudden change of their physiological
And secondary sexual characters.
emotional characteristics.
Hmm.
That is the reason of these cases in the adolescent. Okay. Even adults also. Okay. In adulthood stage also, around 80% of cases above age of 20. Okay. In even older case also, nearly 25% of cases you can find in the older cases. Means depression is across the lifespan. Depending on the stage, depending on the age, the percentage of depression, the number of cases in the depression maybe varies, maybe different. Okay. What are the risk factors of that is depression? There are chances of
Suicidal
ideation.
Suicidal.
Three stages of suicidal. One is
Sir, I'm sorry. What could be the reasons for childhood
Suicidal?
depression? Any idea? And Dina? Sir? Hello?
suicidal ideations,
Hello?
suicidal thoughts, then suicidal attempts. Okay. In all these various stages of suicidal ideation, thoughts, and suicidal attempts or suicides, depression is the root cause. Depression is the one of the main factors of the suicidal tendencies. Okay. In some cases, even though the psychotherapy may be the behavior modification, so after addressing the cases, there is a chance of relapse. What is relapse? Repeating the same issues. For example, sleeplessness in the depression. Continuous sleeplessness for weeks, for months, leads to suicidal tendencies, suicidal thoughts, then suicidal attempts. There are three stages in the suicides. I repeat: suicidal ideations, suicidal thoughts, then suicidal attempt. The root cause of these all the three stages is depression.
Sir, ideations means, sir? Initial one.
Okay. There are some challenges of therapeutical procedures. One is depression in a horrible experience of many patients. If somebody is asking about the depression, what are the reasons of the depression in childhood state? Parental background, parenting styles. As already mentioned, in childhood, very few cases, but even though in childhood stage also, there are some reasons. One
Child
is
abuse, sir. Child abuse.
one is family environment, parenting styles, and one more reason of depression is some genetical reasons also. Yes. So the challenges in therapeutic process, one is horrible experiences for many patients. Depressed patients are sometimes difficult to work the with the therapist, with the psychologist, or you can say with the counselors. Okay. So here, in these cases of depression, you better to establish the rapport first, allow them to disclose the things, allow them to share their feelings, allow them to express their emotions, so that whatever the issues, so they will be in a position to express, they will be in a position to share, they will be in a position to ventilate. So that is the reason in psychological counseling, any sort of psychology, any issue, whatever the issue may be, listening skills are more important. The more you listen, the more you will understand the patient. The more we listen, the more we assess the patient. Assessment means, for example, depression, maybe anxiety. When anxiety, depression, I already mentioned some tools of anxiety, some tools of depression. Whether the depression is severe, whether it is mild, whether it is borderline. Okay. So how you assess? Initial assessment is your observation, through your observation. We know there are some methods of psychology. Number one, introspection method. Number two, observation method. Number three, experimental method. Number four, case study method. Number five, survey method. See, in observation method, when you are seeing the patient, when you are observing the patient, when you are listening the patient, it is easy to assess the patient. That is the reason in any psychological issue, especially for the depression or anxiety cases, the more we listen, the more you can understand the emotions of the patient. The more we listen, the more you can assess the patient. Assessment means I'm talking about the whether he is in a severe depression, whether he is in the mild, whether he or she is in the moderate. So if you confirm, if you have an idea after observation of the patient, you can go for the tools. You can apply any tool. As I mentioned, HAMD, HAM, Hamilton scale of depression. So initially, when you're observing the patient, when you're observing the client, you can assess up to some extent. For example, after completion of your this rapport in the first session, second or third session, he came to you, or she or he came to you, his expression, she's expression, her emotions. In that listening process, what you will observe, she will be in whether she is in various stages, maybe as I mentioned, mild, moderate, or severe. For example, if in your observation, if you observe that he or she is in severe depression, what to do? We need to use one tool of assessing the depression. That means HAMD. In that HAMD, that is the system, that is the tool to confirm your observations. Initially, no need of using tools. What happens directly if the patient came to you, and if you start using that tool, if you start asking some questions of that tool, what happens? It's not too easy to express their emotions. That is the reason first, second, third sessions, establishment the rapport, then observation. After one or two sessions, if you confirm, if you have an idea about this level of depression, severity of depression, then you can use the other tool to confirm your observations. And you need to follow some guidelines, especially in case of suicidal tendencies, even for the depression case also. Conduct whatever the interview, whatever the tool you are using, you have to be very careful. Okay, based on their age, depending on the observations of your initial stage. Okay, so that's the reason listening in various aspects to get the information from the client, to get the assessment, to assess the patient, and when you listen more, you are giving an opportunity to share their emotions. In some cases, what happens in patients, they may not be in a position to express their emotions within the family members also, because nowadays wife is not having time to listen the husband's issue, husband is not having time to listen the wife's issues, children are busy with their activities, they are not in a position to listen the parents, and the parents also busy with their professional or other activities. So only to share their emotions, some cases only to the share of their emotions, they'll come to the psychologist so that they will be free, they ventilate their emotions. Okay, so in these cases, for example, the severe cases, even establishment of rapport is not that much of easy. It's a toughest task. So that's the reason, and here some important that is guidelines I'm talking about. So conduct careful interview. Number two is always be empathetic understanding from the other's perspective. Okay, that is empathetic understanding. As I mentioned, listening. Second is empathetic understanding. So if these two stages, listening stage and empathic stage, so what happens? So some rapport establishment will happen within the psychologist or the client. Okay, then you can go for the cognitive restructuring, cognitive therapies, behavior modification therapies, okay, and so on.
Sir, one small doubt, sir.
Yes.
If in third session or fourth session, after using the tools and techniques, we came to a conclusion that the client is having suicidal severe tendency. Shall we disclose it to the spouse and family members? Sir, got it, sir? Sir?
1 minute, I use the headphone so that I Hello.
Hello.
Yeah, tell me.
Sir, suppose after 2 or 3 sessions of our counseling and using techniques, we came to know that the client is having severe tendency of suicidal tendency. Shall we disclose that thing to the spouse and family members?
Yes. Generally, see, depression case directly they won't approach the psychologist.
Yes.
Generally, along with the caregivers or along with the family members only they come to you.
Yes.
For example, if the only person of depression case come to you, you better to inform to the caregivers or the patients. If you observe any severe cases of depression, better to inform to the family members.
Okay, sir. Thank you.
Yeah. Any other doubts? So in these both cases, the anxiety and depression, and one more thing. Here, you can give some instruction to the family members. For example, if these severe cases of depression, mostly severe depression cases, leads to suicidal tendencies or suicide attempts. Better to give instructions to the family members.
Okay.
Yeah. For example, they are not interacting with other family members in the recent times. So that is one observation you can ask. You can instruct the parent whether he or she is interacting in a systematic way as they interact in the previous days. That one instruction you can give. Then the second thing is that is sleeplessness. Okay, if they observe any problem with the sleep, the family members may observe some sort of issues with the sleep pattern. That also you can do some inspection to the parents or caregivers, family members. Third one is their these food habits. There is change in their intake of the food. Got it?
Yes, sir.
These are some instructions in there. If there is any sudden change of their lifestyle, if there is any sudden change of their sleep pattern, any sudden change of their food habits, suddenly they will isolate themselves from the family. These are the alarm signs. You can say red flags. Yeah.
Okay, sir.
So based on these observations, family members also observe some changes in their lifestyle, so that they'll inform. Any doubt?
No, sir.
Then we will take the next unit, that is 23rd unit. Counseling for stress and burnout. Counseling for stress and burnout. Stress is, what is stress? Anyone? What is stress? So stress is a negative emotional experience. Yeah, it's a negative emotion. We have some positive emotions, some are the negative emotions. Stress is the negative emotional experience associated with the behavioral, biochemical, and psychological changes. I repeat, there are some changes in the stress cases. First of all, stress is a negative emotional experience. In this negative emotional experience, there are some associated symptoms of behavioral, psychological, and biochemical, like bodily responses. For example, behavioral. Behavioral means their behavior, maybe some abnormality you can observe in the behavior of the person who is in the severe stress. Okay. That is number one. Number two, psychological issues. What are the psychological issues? Feeling upset. Yes. Inability to concentrate. Irritability. Loss of self-confidence.
Sleeplessness.
Yeah. Difficulty in making decisions. I repeat. There are some symptoms of stress, psychological symptoms, behavioral symptoms or behavioral responses. Okay, then bodily response, or you can say physiological. These psychological symptoms, one is feeling upset. Number two is inability to concentrate. Next one is irritability, loss of self-confidence, worrying, difficulty in making decisions. Okay, these are all some symptoms in case of stress. Okay. Then behavioral, not mingling with other members in the group. Then increased or decreased sleeping. I can say sleeplessness. Okay. Deteriorations in performance effectiveness. Their performance will be slow or low in the stressful situations, maybe severe stressful situations. Okay. Maybe some sort of new habits like smoking or alcohol, smoking and use of alcohol. These are all some issues related to the behavioral aspect. First one is psychological, second is the behavioral aspect. Third one is biological, or you can say bodily response, physiological. Rapid pulse means pulse rate may be increase the pulse rate. Okay, increase the aspirations, tension in arm and leg muscles, shortness of breath. These are all some symptoms or issues related to the physiological. Okay. And in the other aspects, like productivity may be decreased if they are in the job with corruption. Their productivity may be affected, is negatively affected. Okay. So these are also some issues we have to change in these symptoms. For example, if the stress affected, there are two types of stresses. One is positive stress. Second is the negative stress. What is positive stress? Stress is needed or not? Is it?
Yes, sir.
Yeah.
Stress is always needed, sir. But
Always needed.
no.
Hmm.
To some extent, it is needed.
Madam,
Sir.
can you give an example in which examples in which situation stress is needed?
Sir, suppose to get a good rank in the examination.
Yes.
Like that, sir.
That is positive
To
stress.
submit my assignments in time.
Assignments in time. Yes.
Okay. You are all, I think, in stressful conditions to submit assignments.
to achieve desirable
Yes,
goals.
yes, 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 yes.
Hmm.
To reach our goal. For example, already we set a goal. In order to reach the goal, so some
Sir,
stressful.
that is not a positive sign. In fact, we are trying to stress out more than what we are capable of. Okay,
Okay.
that is the healthy lifestyle is how we manage our stress and our competencies as per that. Okay, and coming to the athletics, that is a regime, or someone trying to get a gold medal, that's a regime they follow. Okay,
Okay.
stress is something that is pressure and tension, which is a negative thing. That's something it's really misunderstood in this part of the country, in this part of the world.
That means if the efforts for achieving a goal, the stressful condition, is it positive or negative? For example, tomorrow is an examination. Without stress,
Sir, that's what, sir, that is, sir, you would like to have a stress-free environment and mindset, right?
Mhm.
That is that's what we are all looking for. I want to have a stress-free and thought process and mindset when I'm going to an exam. If I am going to, even I get stressed and tension. Okay, that is definitely, I don't vouch for it, and I don't say that is a positive sign that everyone must go through. No, that's something that we all should overcome and say and find ways to overcome that. Not that
Moderate
to
amount
flaunt
of
it and say, sir, no, sir, I don't agree. That is what the Narayana colleges and Chaitanya colleges are doing. And that's what the corporates are doing.
Okay.
some stress-driven situations are required to pass through examinations and get a
That is
good
what, that
result.
is the negative thought, that is negative mindset.
Up to some extent, optimum level of stress is advisable. It is
That is what, sir, that is competency, sir. That's what I'm saying. Competency. If you define a qualified worker, what is a qualified worker? You have to have a ergonomics and environment for a quality worker, qualified worker, to give you a productive output. Am I right, sir? It is defined in industrial engineering.
okay.
When you follow those things, you will not have stress. Even your time and motion study says that. Maybe the situations won't allow us the kind of financial and what's say development or backward situations we have in our country may not allow us to get there, but it doesn't mean that we vouch and flaunt and appreciate that stress. No, sir, I don't agree to that.
Okay. So as far as our subject or our
Sir, yeah, sir, I'm just trying to put the views. Sorry, sir, sorry to intervene, sir. Okay.
yeah. So then what is burnout? Burnout. If the effectiveness of a person is deteriorated, then it is decreased by the psychological issues. Okay, what happens if he or she is not managed with the stressful conditions for the continuous months together or years together? Slowly, what happens? That stage is beyond their control. That means burnout stage. Too many demanding, frustration, or otherwise stressful situations leads to some sort of burnout situation. Constant pressure to do more than what we do, what we can do. Okay, too much time consuming to achieve only one goal, one small task, that also leads to burnout situation. Then depression, environment, like depressing, the environment is not up to the mark, not suited to the particular person. That also leads to burnout. Then poor interpersonal relationships, constant these disappointments. Okay, so these are all some reasons of stress as well as the burnout. So if the person is not in a position to cope up with the situation for long time, slowly, it leads to burnout. Okay. So some possible sequences of these burnout. One is environmental, number one. Number two, demands are challenging. Environmental demands are challenging. So it leads to stressful condition. Later on stages, it leads to burnout situation. Then physical and psychological alone. Physical and psychological some issues leads to stressful conditions. Further, burnout. Demands are more than one can handle. If the demands are more, if he or she is not in a position to handle those demands, to reach those demands, it also leads to stressful conditions initially, then burnout. Okay. Then what are the various coping strategies of stress and burnout? Okay. So one important aspect is that behavior modification, as already mentioned, the same, whatever techniques we are using, what are the theoretical procedures we are using, we will use to the depression cases. Here also, same therapies or techniques we can apply to address the issues of stress as well as the burnout. Okay. So here also the same techniques as I mentioned. See, in your examination point of view, what the question will be like that. See, what is anxiety? How to give the counseling or psychological counseling to the person of anxiety, dealing with anxiety. That is one. Number two, define depression or what is depression? How to counsel the person suffering with depression, or you can say depressed person. Number two. Number three, stress. What is stress? How to provide psychological counseling to this person facing the stressful or burnout. In all uh, these questions, one important this type of one important this uh, way of giving answers is you have to define the first. For example, if it is anxiety, what is anxiety? What are the types of anxieties? As I mentioned, specific anxiety, phobic anxiety, phobia, generalized anxiety, that is GAD, PTSD, OCD, okay, GAD. So these are all the various types of anxieties. So anxiety, what are the different types of anxieties? Number next, we will explain the what are the symptoms of anxiety, various symptoms of anxiety, like behavioral symptoms, physiological, psychological. Then factors, or you can say reasons of anxiety. Then providing the counsel. How to provide the counsel, how to give the counsel, the anxiety. Then depression. What is depression? Symptoms of depression, factors of depression. Then counseling procedure for depression. Then third one, stress. What is stress? Symptoms of stress. Okay. Then factors related to stress. Then how to provide the how to give counseling for stress, and then what is burnout. In all these three or four issues, the therapeutical procedures are common. Mostly it's a common. Okay, CBT. CBT is a cognitive behavior therapy. In CBT, again there are different techniques of providing counseling. Techniques of counseling. As I mentioned, cognitive behavioral therapy. Why it is cognitive behavioral therapy is when you are changing their cognitive, automatically their behavior may be changed. CBT. In that, CRT is one technique, restructuring a thought process. Then behavior therapy, or you can say behavior modification. For example, poor social skills. So improve their social skills to modify their behavior. In order to modify their behavior,
Sure, sorry for the interruption. Is stress and burnout is the extension of stress? When
yes,
stress is extreme level, then we will get the burnout.
yes. First level
Okay,
is stressful condition. If he or she is not in a position to manage their stress, furtherly they'll face they'll be in a position to they are in the burnout situation.
Okay, thank you, sir.
Okay, so got it. So in all these 4 or 5 cases, the therapeutic approach is the same. CBT. So here, in CBT also, maybe individual counseling can be some cases, group therapy, or you can say group counseling. In individual counseling, so effective coping strategies we have to this train up these cases. Okay, so because stress is the state manifested by a specific syndrome of biological event, some sort of biological aspects, maybe biological reasons also may be there in these stress as well as the burnout cases. Stress is a dangerous when it is unduly prolonged for a long time. So that next stage of this continuous stress leads to burnout. Okay, stress is somehow it is nervous system, nervous tension. Stress is not always the non-specific result of damage. So this stress is manageable up to some extent. If this stress is not managed even for a long time, even after some months or years, it leads to burnout. Okay, as I mentioned, depression a long period of time leads to suicidal tendencies. The same way here, stress for a long time, stressful conditions, stressful situations for a long period of time leads burnout. Okay. Then one other thing is that ABC model. ABC model is that is also one technique in the CBT. Okay. Depending on the ABC, for example, if the belief system is in a negative way, their activated event. So if you change the belief system from the negative to positive, automatically their activities modified their activities from the negative activated events from negative to positive. So the consequences automatically will be the positive. ABC model is also one technique in addressing the issues of these stressful conditions as well as the burnout. Then another one is the REBT. REBT means what is REBT? Anyone of you? REBT, what is REBT?
Rational emotive behavior therapy.
Rational
Emotive
Emotive
therapy.
behavior therapy.
Rational Emotive Behavior Therapy, REBT. If their belief system is not in a logical way, a rational way, irrational belief system to be modified, to be changed to the rational. If there is no rationality in their thought process, there is no, if you find any problem of their these thought process, like irrational, illogical, in those cases, better to rationalize their emotions. Unnecessarily, some sort of feelings, unnecessarily, some sort of negative thoughts. That means irrational negative thoughts, irrational belief system. As I mentioned, already giving one example also. I am waste fellow. I am person having low confidence, worthlessness. I am not worthy. I am not worthy. These are all the overgeneralized feelings. Okay, like in case of that is anxiety, like generalized anxiety, phobic cases. In phobic cases, especially the specific phobic cases like hydrophobia, hydrophobia, agoraphobia, means they think that if they reach the third floor or fourth floor, immediate chance of getting coming to base. So these are all the irrational beliefs, irrational emotions. So if you observe any irrational belief systems, so better to use this REBT, rational emotive behavior therapy. That means rationalizing their irrational belief system. Explain the rationality instead of irrational belief systems, irrational thoughts, irrational emotions, illogical emotions. So REBTs, see, you are as a counselor, as a psychologist, you are free to opt which tool is to be used in these cases, or which therapeutical technique to be used in these cases. There is no hard rule to use this specific technique only in these cases. Not like overall CBT, cognitive behavioral therapy, in this CBT, various techniques. If the thought process is not uh, the mark, better to deconstructing, restructuring their thought process means CRT, cognitive restructuring technique. Can use them. Their belief system is not in a positive set, better to use ABC model. Activated event, belief system. Their emotions are not logical, illogical, irrational emotions, if you observe, are EBT. They want to change their behavior of not mingling with others, isolation, problem of communication. So to improve their communication skills, to improve their social interaction skills, social skills, better to use the behavior modification. See how many techniques we have. Behavior modification technique, REBT, ABC, CRT. In some cases, psychoeducation also, psychotherapy also, psychological education, especially in case of severe cases. Better to provide psychological education to the caregivers because direct counseling to the client is not possible. For example, the case is schizophrenia case or any severe cases of depression. Better to provide psychoeducation to the caregivers or the family members. Any doubt? Then counseling to adolescents for better adjustment. What is adolescent actually? What is adolescent? We have different stages of lifespan. In the stages of lifespan, initial stage is infant stage, then childhood stage, adolescent stage, adulthood stage, middle age stage, old stage, old age stage. This is the broad stages of lifespan. stages of lifespan development. So the term adolescent is derived from
Sir, 12 to 18 years age, sir.
12
That is
years.
good.
Infant is between 0 to 3 years, 4 to 11 are 12 years, childhood stages. Again, in childhood stage also there are two sub-stages, pre-childhood stage and later childhood stage. Okay. Adolescent stage is from 12 to 18 years. In some cases, 13 to 19 years. Depends on the geographical conditions. In the Western countries, maybe 1 or 2 more or less. In the other African countries, so it depends on the various geographical conditions. Okay. So overall, between 12 to 18 years or 13 to 19 years. This is the age of adolescent. Adolescent is derived from the Latin word adolescere. Adolescere means the literary meaning of adolescere means stress and strain, age of stress and strain, age of storm. Okay. One. So this adolescent term is derived from the Latin word, which means stress and strain. Why this age is called age of stress and strain? What is the reason behind it?
Sir, it is the transition period between the childhood stage and adult. And emotional development is also
Emotional development or emotional imbalance stage?
Imbalance stage, sir.
Exactly, yes. Because based on their, depending on their physiological, sudden change in the physiological aspects,
Yes.
sudden change in the psychological aspects, they have more stress in this particular case. That is the reason the term adolescent is derived from the Latin word, which means stress and strain, age of stress and strain. Why the stress and strain means? Because of these that you are talking about. Sudden change of the physiological milestones, or you can say physiological changes. Then psychological changes, because their psychological development leads to the peak in this particular age. And one more, even educational changes. You know that in our education system, Indian education system, 10 plus 2 plus 3 ladder. The ladder of our Indian education system is 10 plus 2 plus, of course, recently it is changed, but 10 plus 2 plus 3. Both first stage and second stage, like 10th stage and 12th stage, is both stages, they need to go in this particular transition stage. They need to achieve, they need to pass, they need to cross the 4 stages of 10th and 12th in this transition stage. That means stress from the physiological aspects, stress from the educational aspects, stress from the psychological aspects. These all various stressful conditions, their emotional status is in the imbalance stage. Okay. So automatically events from the social, from the peer age group also, will have some sort of stressful conditions or issues. So in this scenario, in these various stressful conditions, they'll have a problem of adjustment issues. So the
Sir,
units here,
they are not, sir, sorry to interrupt,
yes.
sir.
Mhm.
They are not they are not aware of all these physiological and emotional changes. And previously, in the home itself, in the combined families and elderly people and everybody will take care of all these emotions of the adolescents. But nowadays, everybody is busy, even parents and
Yes.
nuclear families.
Yeah.
That may be the reason, sir.
Yeah, that's one of the reasons.
And
Previously was joint family.
due to lot of stress and competition facing in the educational institutions from parental side and educational institution side is also there, sir.
That's what I thought. See, it is all the various perspectives, various angles, various dimensions, various directions, which leads these adolescent people in these stressful conditions, situations. Because some sort of even learning problems, so some sort of specific learning issues, problems related to the vocational, so problems related to the interpersonal relations. Yep. So these are the various issues of their small adjustment, or you can say they are not in a position to adjust with their families. They may not be in a position to adjust with their own self. They are not in a position to adjust with the society. They may not be in a position to adjust with the peer age group. Yep.
Yes, sir.
Yeah. In Erickson's model of adolescent development, Erickson's model, Erickson's theory, 8 stages of psycho-social development theory of Erickson's. Gone in the first year. Why you are asking, sir? It's in the second year. No? Erickson's theory?
We have in this.
Yes,
some-
sir. We are aware of it.
Yes. 8 stages of Erickson's theory. Trust versus mistrust.
Yes.
Yep. In these 8 stages, one stage is the crisis, identity crisis. When they enter into this adolescent stage, identity crisis, some siblings or some parents or some elders, they'll tell, you're grown up, why you are behaving like that? The same family, some parents, some elders, they will tell, you're a kid, don't behave like an elder. Yes? That means identity crisis, whether I have to play the role of kid, means child, or grown up. That means identity crisis. So in Erickson's model of adolescent development, identity crisis, they need to go through this stage of identity crisis. Then second one is fear of intimacy. This fear of intimacy they face from the peer age group. Fear of intimacy. If I am more attached to someone, maybe girl or boy, what is the impression of my elders? What is the opinion of the society? That is fear of intimacy. That is another thing. Then diffusion in time perspective. So their thought process will be like not like a elder, not like a adult. That is the reason how to behave. That is the reason of identity crisis. So here various issues related to this psycho-social development of that is known as the identity crisis. Then problem from the peer age group. Peer age group means challenging religious traditions, widening this age gap, reducing the time to adults and children spend together. They won't show interest to mingle with adults, old age people, but they don't want to mingle with the younger ones because they always busy with the observation of their own self. In some cases of adolescent, they'll try to, they'll always focus on the various changes of their physiological aspects. They are more focused on these aspects. Yes. And one more important characteristic of this one is idol worships, or you can say models. Some adolescents, they are more focused on the cricketers. Some adolescents, they are more focused on the senior actors. Some adults, they are focused on various professionals as their role models. That is the reason they are focused always on those personalities. Okay. So okay, we have already time is 7:04. So you do one thing. Tomorrow is the last class. If there are any doubts, any other discussions?
And sir, if you have prepared any notes or slides, can you share in the groups?
See, my class is like that. I won't prepare any these notes or these things, whether you observe it or not.
Yeah, we have observed it.
Within this 1.5 hour class, 1 or 2 times of my same topic is repeated.
Sir, voice is very low, sir. We are not in a position to
Today's
have a
voice or
clarity.
daily?
Little bit, sir.
Today only.
Thank you.
So tomorrow, if there is any other, okay, I will try to make it fast. We're talking about some these questions. Notes is not possible. If it is possible, some questions I'll explain.
Examination point of view.
That's what
sir.
examination point of view.
Yes, sir. Yes, sir.
I'll try to make it possible.
Thank you, sir.
Okay, sir.
Thank you. Thank you.
Thank you, sir.
But anyway, your examination you already know now. The examination timetable already announced from the university.
Yes, sir. Yes, sir. Yes, sir.
Is I think in August, no? August last week.
July 30th to
July last week of the second year.
30th to 3rd, sir.
Yes, July to 3rd
31st.
3rd August.
31st.
July 31st to 3rd August, sir.
3rd.
4 examinations. Fifth one is our
Sir, it will be morning or evening, sir?
So I can't say now because they will fix the timetable. They'll announce for a few weeks. They'll announce the timetable. Anything else?
Sir, for suppose for short answers also we have to write all the steps, sir. What you told before.
Briefly, you have to explain. Briefly,
okay. Okay, sir. Okay, sir. Okay, sir.
Transmits only 5-6 marks questions. I think. Yeah, 5, 6
okay,
are 30. 4 10s are 40. For
okay,
questions 10 marks. You need to answer out of 8. You need to answer 4.
Okay.
Each question carries 10 marks. This 4 10s are 40.
Okay.
For short answer, 30 marks. No? 5 questions you have to answer. Each question carries 6 marks.
Okay, sir.
30 plus 40, 70. That is your main examination paper.
Okay.
30 marks allotted for your assignments. 2 assignments you have to submit.
Okay, sir. Okay.
That is the actual pattern of examinations.
Okay, sir.
Right. Best of luck.
Thank you, sir.